Welcome back to Healthwise. With us is Dr. Chancellor Donald with Louisiana Oncologist Associates. And Doc, as I was saying before, we need to discuss, because, you know, we always hear this, and I'm guilty of it just like anyone else. Sometimes we want to go to the big cities. And because I don't know if it's that we don't trust the local hospitals or the local doctors or whatever, or we think because it's a big city that they know better or they have better equipment or whatever. And I just want you to kind of talk on that and explain that, you know, what we have here is the same as they have everywhere else.
Sure. First off, I always try to make sure my patients feel comfortable. If it is more comfortable for someone to leave and be in another city, I would never discourage that. Right. Even if it's the thought that they're receiving something different, if that's something that will ultimately help them feel better and help them deal with their situation or their malignancy, I'm all for it. What you have to realize, though, is in the practice of medicine, we have what we call the standard of care. The standard of care often is based on comparing two different groups who either got the treatment that we're offering or another treatment or no treatment at all, and comparing those two groups to see what the outcomes are. Who lives longer, who does better, who feels better. As long as there's a standard of care, as long as we have a given regimen, a given way we treat something, we really can't deviate from that. So if you have a common type of illness, and we don't have to just talk about cancer, we can talk about heart disease. Right. You have a certain type of heart issue, you have a certain type of cancer. If it's common enough, even if you go to these big institutions, they're going to treat you with the same standard of care that would be offered often at your local facility. Right. Now, when it is time to go and consider another facility, at least in the setting of cancer, that's often when you have a really rare tumor. Sometimes you would want to go because with a rare tumor, you sort of want someone who's dealt with that tumor a lot more. Right. But again, often people have common illnesses, and we can deal with those common illnesses. Another setting that you may want to consider going to another institution would be if you've tried the standard of care, you've tried the standard things that come after that, and you're still well enough to take more therapy. Then you can enlist in something called clinical trials. And that's when they're often comparing a new agent or a new combination of known agents or medicines to see what the effect are. Now, different clinical trials look for different things. Some clinical trials may purely be looking at the toxicity that could be caused by a new medicine, meaning that the hope isn't necessarily to prolong life, but to learn more information about the drug. So that's a very important concept to know. Other times, and more often, the clinical trials are comparing new combinations or new agents to older agents. And you may get a response with it, you may not get a response. But to be clear, if it was known that you're going to get a predicted good response with the new medication, that often would become the standard of care. And you likely would have been offered that up front at your local facility. But again, I always want people to feel comfortable. We work well with different centers. I was at Tulane for 7 years before I came here. I know people at Anderson. I know people at other facilities. If people want to go, I absolutely advocate it. But I think one thing that doesn't get considered more often is that having a diagnosis of cancer is very difficult, and you have to place value on your support system. So to go to another city where you may not know anyone, where you may be in a hotel, or you may be in a dormitory type setting, that may have inherent stresses to it that being at home, surrounded by family, surrounded by familiar people, love, support, and good food, because this is Opelousas, you know, that's something really that you should consider. And again, it comes down to an individual decision, but I think it's best that people really know what they're getting into when they leave the local surrounding.
Well, like I said, I think people too think big city, better medicine. And I think aren't y'all on the same network like MD Anderson and stuff? even though it's a different city, y'all kind of work together. You're going to work with the people. If there's something like you said, standard of care, it's going to be
absolutely
the same.
And Louisiana Oncology Associates has a long history of coordinating care with different facilities, from Little Rock, Arkansas, back to Tulane, to MD Anderson, to LSU. There are well-established relationships, not with just those facilities, but with the physicians at those facilities. So if it comes to doing that, it's not a problem for us to do that at all. But again, I think you can't discount the comfort of home,
sure,
especially when you're going to be receiving the standard of care,
right,
and essentially the same type of treatment, be it here or in another location.
Mm-hmm. And as you said, there's certain stressors, and it's kind of been proven that, even with not only cancer, but all diseases, that, if you feel good about where you are, feel good, you're going to feel better. Maybe it'll help with the illness,
Sure. I mean, you're right. There have been studies that looked at not only optimism, as far as people having a positive attitude and feeling
mm-hmm.
good and positively about things, but people feeling in control. And going somewhere different, being in a strange surrounding, you lose a little bit of control.
Sure.
You can't control, things are just foreign to you. The route from the hospital back to where you're staying, the food that you're able to eat while you're there, the people that may be living next door to you, all of these things could contribute to the stress of dealing with an illness. So I think, again, all of those things should be routinely thought about and considered heavily before deciding to go to another institution.
And I'm sure you talk to your patients about that, all that, when they know that's part of the whole package of the oncology.
Absolutely, absolutely. There's a physician at Tulane, his name is Roy Weiner, and I never
mm-hmm.
forget, he said to a patient, he said, I treat patients with cancer. I just don't treat cancer. And sometimes treating the patient means not treating the cancer, or treating the patient in a different way that's not giving such consideration to the cancer. And that's seeing the big picture. That's knowing how to look at someone as a total person and as someone who has a given role in their community, a given role with their family, and then tailoring the treatments to give them the best outcome. And that's part of why I came here. I think the group that I've joined, they all exhibited these attributes. From Dr. Rainey, who's been here for years, Dr. Briere, Dr. Cole, Dr. Rinaldi, and Dr. Roden, I think they've all contributed to this mindset and this philosophy. And we have an outstanding support staff of physician assistants and nurse practitioners and nurses and everyone associated with LOA that gets this very concept. And that's why I'm here.
Great. Well, Doc, we've got a couple of seconds left, about 30 seconds. Won't you tell the audience again where you're located, how to get to your place, and what's your address over there?
Sure. So I'm over near Opelousas General Hospital, right on Prudhomme Lane. I'm also over in Lafayette 2 days out of the week, off of St. Mary. This is near the Our Lady of Lourdes campus, the older campus, and actually in the spring we're going to be moving off of Ambassador Cafferty with the new campus, and we'll have a new facility, but the same great support staff and the same physicians that have made us a pretty good organization, in my opinion.
Well, Doc, thank you for coming and joining us on Healthwise, and thank you, audience, for joining us on Healthwise, and we'll see you next week.
Healthwise is brought to you in part by Opelousas General Health System.